So, as reported in the Ministry of Health's 1 p.m. media release, there are 11 new cases of Covid-19 in the community to report today. This brings the total number of community cases associated with our Auckland outbreak to 31. The international airline crew member has now been reclassified as a border-related case, and this is not included in the community case figures. Of the 31 community cases, 19 are now confirmed to be epidemiologically linked to that Auckland outbreak, and the other 12 are being investigated, but there is every sign that they are linked at first glance. Of today's cases, 3 are in family bubbles with previously reported cases, and 2 are in the same family bubble. 8 are in Auckland, while 3 are in the Wellington region.
On the good news, while some interviews and investigations continue, we believe, as Dr. Bloomfield has already said, that the cases we have to this point in time are linked. That's important because it means we're starting to build a picture of the edges of this cluster. At this stage, we don't have random cases popping up outside of those places where we already expect them. But while we are in a reasonable position at day 3, with Delta, we believe it is too soon to draw any firm conclusions. There are a couple of reasons for that. The first is we don't yet know the spread of the virus amongst the contacts we have identified. Our public health teams generally ask people who are contacts to be tested 5 days after they were in contact with an infected person to ensure that we don't test people too early and therefore get the wrong result. That means we are still waiting on a large number of contacts to be tested and results returned over the coming days, which will help us to determine the reach of this outbreak. Also, as you will have seen, we're dealing with a large number of locations that we sadly know from experience do lead to more cases. Bars, schools, and church services where people are in close contact for long periods of time. We don't yet have all the results from these locations. Thirdly, we now know that we are dealing with an outbreak that isn't just isolated to Auckland, with cases now in Wellington, albeit linked. While they were picked up quickly, they came into contact with a case on Sunday, and obviously we were in lockdown by Tuesday. We still need to be very vigilant. Our contact tracing shows, in fact, we have hundreds who were at locations of interest, who we know live and are isolating outside of Auckland. That includes in the South Island. So we do have people who have been at locations of interest across the country. Finally, because we are only in day 3 of our lockdown, when we are finding positive cases, their infectious period is still reaching back into the period before we went into lockdown. Now, soon that should stop being the case, and that will definitely help us get the outbreak under control and help us determine the edges of the outbreak. Till then, though, we just don't quite know the full scale of this Delta outbreak. All in all, that tells us we need to continue to be cautious and that we need more time before we have the complete picture we need to change our settings. So on that basis, the Director-General of Health has recommended and Cabinet has agreed to keep all of New Zealand at level 4 until 11:59 p.m. on Tuesday, August 24, with a Cabinet meeting on Monday for us to determine the next steps thereafter. Going to Tuesday is a full 7 days from our first case returning a positive result and gives us that extra time I mentioned that we believe we need. It's much better to assure ourselves now that there aren't further cases in the rest of the country than allowing the virus to spread easily at a lower alert level, and we've all seen what happens when you take that path. But we need to use this time wisely too, and so here is our ask of the team of 5 million. Number 1, please check the locations of interest, and if you were there at the time and date set out, then get a test. I would put emphasis on there at the time and date because there is a level of specificity in our locations of interest, and we don't want people having to get tested because they were there the day prior or even hours prior. We do set out the specific times that do apply. If you are contacted by our contact tracers, get a test. If you have cold and flu symptoms, get a test. Only by ensuring everyone who is a possible contact is tested can we feel comfortable that we don't have undetected cases. I do want to acknowledge, as Dr. Bloomfield did, that many people have been doing the right thing and have encountered long wait times at our testing stations. We are incredibly grateful for your patience. We are standing up extra testing today and this weekend to ensure all those who need to be tested are. But please do remember, you can also call your GP to see if they are testing. That may take pressure off the drive-through testing stations as well. Number 2, if you are a contact, then please stay at home and isolate. In some parts of Australia, we did see contacts who went to work and spread COVID. We need our contacts at home and isolating. Number 3, to everyone else, please continue to stay at home and stick to your bubble. This isn't a time to be complacent. We do have COVID outside of Auckland. It may well pop up in other parts of the country in coming days. The last thing we want is to further spread the virus during lockdown because that only runs the risk of prolonging it. Number 4, if you're visiting an essential service like a supermarket, a dairy, service station or pharmacy, you are required to wear a face mask. This protects you and others. We need to all act as if we have COVID and that those around us have it too. We are also just asking for people to wear a mask when they leave their home generally. It's an extra layer of protection to keep you safe when you're out and about. Remember, people have got the virus simply by walking past someone, so it is an extra layer of protection. Number 5, wash your hands and scan in when you visit an essential service. And 6, please be kind. Use this time to check in with friends and family this weekend over the phone or via video call. I know it's hard being separated, but following the rules to the letter means we can reconnect faster. Finally, a quick reminder that even though I know we all want to block out the memory of 2020, we have been here before. We know the elimination strategy works. Cases rise and then they fall until we have none. It's tried and true. We just need to stick it out. If people break bubbles, visit friends or attend gatherings, new chains of transmission could start and keep that lockdown longer. So please keep up the amazing work and everyone needs to play their part.